Artificial Intelligence Dr. www.abcpharma.net/English. User question. If according GPT4 the Aveir VR leadless pacemaker provides advanced pacing technology and the benefits of a leadless system, why, according GPT4, might not be the first choice for someone with second-degree AV block Mobitz Type I? Cohere AI answer. While the Aveir VR leadless pacemaker offers advanced pacing technology and the advantages of a leadless system, there are a few reasons why it might not be the first choice for every patient with second-degree AV block Mobitz Type I. 1. Single-chamber pacing. The Aveir VR is a single-chamber pacemaker, which means it paces only the right ventricle. In the case of second-degree AV block Mobitz Type I, where the issue is primarily related to conduction delays between the atria and ventricles, single-chamber ventricular pacing may not be sufficient to address the condition effectively. In some cases, dual-chamber pacing, which involves pacing both the atrium and ventricle, might be preferred to maintain a more natural synchronization between atrial and ventricular contractions. 2. Atrioventricular synchrony. While the Aveir VR does have algorithms to promote atrioventricular synchrony, it may not provide the same level of coordination as a dual-chamber pacemaker. In second-degree AV block Mobitz Type I, maintaining atrioventricular synchrony is important to ensure that the ventricles contract in a timely manner after atrial contractions. Dual-chamber pacing systems are specifically designed to achieve this synchrony. 3. Limited diagnostic features. Leadless pacemakers, including the Aveir VR, may have more limited diagnostic capabilities compared to traditional dual-chamber pacemakers. For patients with second-degree AV block Mobitz Type I, having access to detailed diagnostic data, such as atrial sensing and atrial paced event counts, can be valuable for monitoring the progression of the condition and adjusting pacing parameters accordingly. 4. Patient-specific factors. The choice of pacemaker depends on various patient-specific factors, including overall health, medical history, and individual preferences. Some patients may have anatomical considerations or comorbidities that make a traditional dual-chamber pacemaker a more suitable option. Additionally, factors like patient age, lifestyle, and personal comfort with different types of devices can influence the decision. 5. Physician experience and familiarity. The selection of a pacemaker may also be influenced by the implanting physician's experience and familiarity with different devices. Some doctors may have more extensive experience with traditional dual-chamber pacemakers and feel more confident in their programming, troubleshooting, and long-term management. Ultimately, the decision to choose a specific pacemaker, such as the Aveir VR leadless pacemaker or a traditional dual-chamber device, should be made in consultation with a qualified cardiologist or electrophysiologist. They can assess the patient's individual needs, consider the specific characteristics of the block, and recommend the most appropriate pacing system to manage their second-degree AV block Mobitz Type I effectively.